detect illnesses and diseases early in the stages before they escalate and get much worse, because the worse the disease is, the more costly it's going to be to treat it. So these free preventative services are really going to help save a lot of money as far as costs for advanced treatment. The reform will eliminate excessive overpayments, which is the biggest problem right now with the current Medicare system, is this issue with overpayments. Ohio couples on the current Medicare plan will pay an additional $90 within the next year unless this issue is addressed. So another segment of the reform is aimed at eliminating this additional expense. There are 325,000 seniors that will have the costs of their prescription drugs cut in half from Medicare assistance. Almost 325,000 Ohio seniors are affected by the gap in Medicare drug coverage, and they pay an average of just over $4,000 a year because of this poor structure. Small businesses are also going to be affected by the reform. 69% of Ohio's businesses are considered to be small businesses, and only 49% of them offer their employees health care benefits in 2008. So the reform will provide tax cuts that will help 118,000 small businesses have more affordable premiums, which will allow them to offer affordable coverage to their employees. And then the last group is Ohio's state budget as a whole. The reform is going to relieve the state budget from exacerbating healthcare costs, which is obviously the most important issue with the current system, is the rapidly increasing costs of healthcare. The reform will reduce state employee premiums by expanding coverage to uninsured residents, which will decrease the costs of uncompensated care that gets shifted to premiums of state employees. Also, the reform may provide Ohio families premium relief of up to $1,200 per year, and $2.3 billion of uncompensated care will be saved from uninsured people being provided coverage. So obviously the state budget will be heavily impacted by the reform.
And then our conclusion is, as a group, we thought the new healthcare reform is going to benefit our country in the long run. Obviously, in the short run, we're going to incur more debt just because we're spending a bulk amount of money at the start. But if we look at it in the long run, we're going to end up benefiting. Like I said earlier, we're saving about $100 billion annually on all the cuts.